Can the President's health care reform program save Louisiana health care from the governor's health care cuts? Louisiana health care has been in decline for a long time, but Governor Jindal's recent budget cuts are going to make things a lot worse a lot quicker. Louisiana residents have high incidence of chronic diseases, heart disease, diabetes, cancer. But more Louisianans die of these diseases than do folks in the rest of the country. The reason is that these diseases go untreated until the problems get too bad to ignore. The basic problem is a lack of access to affordable health care. People don't go to the doctor because they can't afford it. Our state has one of the highest percentages of adults without health insurance in the country. Reaching affordable health care, frequently LSU's hospitals, can involve long drives and even longer waits to get treatment. When things get bad, the uninsured get treatment, but it is expensive, and the costs that they can't pay are spread over those who can, namely those with health insurance. The Department of Health and Hospitals recently announced how it would implement the Medicaid cuts made necessary by the governor's refusal to back a tax on tobacco to stave off the cuts. You might believe that Medicaid cuts would just affect the poor. You would be wrong. The Louisiana Hospital Association says that the cuts will mean a loss of almost 2,000 jobs at private hospitals over the next year. They warn that Jindal's cuts will mean higher health insurance premiums, co-pays, and deductibles for those still fortunate enough to have health insurance. Things will only get worse next year when the state faces an even larger deficit. Realistic solutions to Louisiana's health care challenges will again fall victim to the governor's national political ambitions. Viewed in this light, President Barack Obama's health care reform program offers the only real hope to save Louisiana health care. Health care reform will invest millions in Louisiana hospitals, clinics, and doctors' offices to update technology, expand access, and improve the quality of care. The administration has already provided new funding for community health centers, health information technology, and for the training of healthcare professionals in our state. The President's plan will improve existing insurance by making it illegal for health insurance companies to deny coverage due to pre-existing conditions or to revoke coverage once the disease has been diagnosed. The President's plan will bring new competition into the health insurance marketplace through a public plan which will result in lower premiums for individuals and businesses. Expanded coverage will mean more paying customers for doctors and hospitals, improving their economic viability. It will also mean that those Louisiana citizens suffering from chronic diseases will be able to get access to affordable treatment earlier, giving them a better quality of life. President Obama's health care reform program will break the cycle of ever-rising costs that force Louisiana businesses to abandon coverage for their employees and that put Louisiana families at risk of financial ruin if serious illness strikes. Governor Jindal's ideology and national political aspirations have locked him into a plan to continue to cut public spending on health care that will have dire consequences for private sector providers and those with health insurance. President Obama's health care reform program is the change we need to fix what ails our state and our nation's health care delivery system. To learn more about President Obama's health care reform program, visit any of these websites.